Good evening, everybody. I'm Dr. Sudeshna Sarkar, Assistant Professor, College of Fisheries, Kishanganj. Today we will learn about dose-response relationships. When a drug is administered systematically, the dose-response relationship has two components. What are they? Dose-plasma concentration relationship and plasma concentration response relationship. The first one, which is determined by pharmacokinetics consideration, where the second one, which is more about dose-response relationship, which can be easily determined in vitro condition. Here we can see that equation. So E is equal to E max into D by KD plus D. So what is that? E is the observed effect of a dose of the drug, and Emax stand for maximal response at a dose, and Kd is the dissociation constant of the drug receptor complex, which is equal to dose of the drug at which half maximal response is produced. So that way we can calculate the E, and E stand for the effect at a particular dose of a drug. So this is the graph where we can see the dose response and log dose response curves, where y-axis stands for response and x-axis represent the dose. With dose, the responses will change. So that is, and here we can see there are two curves. One is, which is the simple curve, where we can see that when dose is getting increased, the responses are also getting increased, and it is forming a rectangular hyperbola, where in case of log dose representation we can see it is forming a sigmoid curve, where in the initial stage, in initial dose, in lower dose, it is showing a lag phase followed by the log phase and finally the stationary phase. Generally, the intensity of response increases with increase in dose, or more precisely concentration at the receptor, and the dose response curve is rectangular hyperbola. If the dose is plotted on a logarithmic scale, the curve becomes sigmoid, and a linear relationship between log of dose and the response is seen in the intermediate zone, which is 30 to 70% response, as can be predicted from the equation. In other words, response is proportional to an exponential function of the dose. Other advantages of plotting log dose response curve are a wide range of drug dose can be easily displayed on a graph, and comparison between agonist and study of antagonist become easier in that case. The log dose response curve can be characterized by its shape, slope and maxima, and the position on the dose axis. So that is all about the dose response relationship. Thank you for your attention. Thank you so much.